Hi everyone, I am Dr. Mustafa. I am consultant surgical gastroenterologist and laparoscopic surgeon at Care Hospital, HITEC City. Today I will be briefly discussing you regarding hemorrhoids. What are hemorrhoids and what are the common questions what we get from the side of the patients? What are hemorrhoids? Hemorrhoids are basically a tuft of veins or the lax anal tissue which protrude out through the anus. Why do this happen? Have you ever observed that the veins what we are having in our body, the neck veins and the hand veins, you might have observed that those who go to gym, they are having this very prominent veins. The reason is if you tone the muscles or if you shout, suppose you are shouting, the neck vein will be very prominent. Because of the pressure, the neck, these veins, they tend to become prominent. So likewise, the veins which are present near the anal canal, if you put pressure, like if suppose you are having constipation, if you are tending to push the stools out and you are sitting on the toilet seat for a very long time, or you are pushing it, the veins will become very prominent over there. And if this is becoming regularly, if suppose this is happening for a couple of months together or years together, that veins might become permanently enlarged. Even if you are not putting pressure also, they will be enlarged. So those enlarged veins, unlike the veins which are present in your skin and the neck, they will not bleed because we were having a very thick skin over there. Whereas at the anal region, the thick skin is not there. The very small, thin mucous tissue is there. So when they become enlarged and because of the gravity, they tend to prolapse like this, they tend to fall out and they tend to bleed because they are not having much support over there. That is what we call hemorrhoids or what we call piles. So most of the patients, they present to us with bleeding per rectum. That is, they present to us that they are passing blood into the stools and they get alarmed by it. By and large, no need to get alarmed. It is not a serious issue. So once we see that, what we do, we diagnose it by just examining it or doing a small sigmoidoscopy. And once we diagnose it, we tend to grade it, how much big they are and how much trouble they are causing you. They are like initial 1 or 2 grades, there is just minor bleed, not much size of the hemorrhoids. Still we can manage with conservative therapy with medical treatment. In those hemorrhoids which are very large in size, we are tend to coming out, which are prolapsing, which are causing pain to you and causing severe bleeding, we tend to treat them surgically. And surgical treatment again is nothing to be alarmed. It is a very simple procedure. Nowadays we are doing it as an outpatient procedure where what we do through a laser, we will remove that vein or that hemorrhoid tissue which has become enlarged, or we are using a stapler. A stapler is a small machine. What it does, it just removes the hemorrhoids without any cut. So likewise, laser removes the hemorrhoids without any cut. The results are very good. You need to come on the day of the surgery in the fasting. We give an enema, clean that area, and then we use the laser or the stapler, and then we discharge you on the next day. After the surgery, you will have minimal pain. You will be very comfortable. You will be able to pass your stools and you will not have any incontinence. This question is, the people, they ask that whether after surgery, whether they will leak gas or whether they will stools. Nothing of that sort will happen. We are having very good results with it, and hemorrhoids is nothing to worry about. After this proper treatment, you will be able to live your life normally. Thank you.